Okay. All right, we are live. Hi, everyone. Hi, Dr. Vinny. This is the Invincible Health Series with Dr. Vin. We're talking brain health today, and we're going to talk about specifically Alzheimer's and diabetes. We've been talking about brain health for the last few weeks, and we've decided to get down into more details about how different illnesses can lead to, to brain cognitive issues as well. So Dr. Vinny, for anyone who doesn't understand, how does diabetes impact our brain and perhaps contribute to Alzheimer's disease?
Yes, so that's probably a 3-hour lecture. I'll try to break it down into just a few minutes. Diabetes can impact the brain in many ways. It impacts our vascular health. So if blood flow is poor, it can impact it that way. But one of the major ways, other than, having vascular disease, is that with diabetes, usually type 2 diabetes we're talking about now, where there's insulin resistance, the cells in the brain actually become resistant to the effects of insulin. And what that means is that they can't really utilize sugar well for fuel. And, if you ever try to run a car on no fuel, you know what happens. You're stuck on the side of the road somewhere, needing to call for help. So same thing happens in our brain. If we don't have good fuel in our brains don't work as optimally as they can. Some people have even gone as far to call certain forms of Alzheimer's type 3 diabetes to emphasize that connection with the insulin resistance that develops over time.
And how recently have we known that there's a connection between those two? Is this more of a recent development, or have people known this for a while?
I would say it's relatively recent. I would say probably been known out there for the past 5 years, maybe a little bit longer than that. As people delve more and more into the causes of cognitive decline, it was noticed that there's that association with diabetes for sure.
Yeah. I mean, I think sometimes people don't realize that there's so many connections between the different illnesses. One may affect a different part of your body, but there's always a connection there. So it's always good information to have.
Yeah. People just think of diabetes as my sugar's too high.
Yeah, exactly. Yep.
That's a symptom of the disease, but the disease is that if it affects the cells, causes insulin resistance, causes you not to be able to burn sugar properly, and then you're trying to run a luxury car on economy gas, and it just doesn't work too well.
Yeah, and I won't talk about how many times I've actually run out of gas in real life, but I do know I have personal experience. So what can be done about preventing, one leading to the other? I mean, obviously managing diabetes, but what else?
Yeah, I mean, if we want to go way back into prevention, it's to when people first start to develop, diabetes is kind of like the end state of a whole probably 10 or 20 years of insulin resistance and then pre-diabetes, diabetes. If we could catch people when they were still insulin resistant and work on them then diabetes would never develop, and we wouldn't have all, the cognitive issues and the vascular issues and everything related to diabetes. So, and how do we do that? And even if people have diabetes, this is, the principles are the same. You get carbohydrates and sugar out of the diet. For people that can do it, they intermittently fast, meaning, in this case, that they fast overnight for about anywhere from 12 to 16 hours. And that helps the liver kind of start to remove fat and carbohydrates from itself. Because when the liver gets full of fat and never has a chance to burn that fat out, you could get a fatty liver, and that leads to more insulin resistance. Okay. So those are the primary tools. It sounds simple, but it's really, it seems like for a lot of people, those are hard things to accomplish. But a lot of people here in the practice have had a lot of success with intermittent fasting. Um, and a lot of people have at least lowered their carbs, if not gone to a totally low carb, low sugar diet. But the more you can lower them, get processed carbs, sugar out of your diet and go more towards like fruits and that kind of thing for your sugars. At least fruits have fiber and a lot of nutrients in them, whereas a lot of things that bring sugar in don't have those things. So
yeah, so ideally we want to prevent the diabetes from ever developing. So, catching things early and sticking to that type of diet will really help prevent diabetes from developing.
yep,
And then leading to, of course, the issues with Alzheimer's.
yep.
But if, hopefully we'll get there one day, but unfortunately we have a lot of people who do have diabetes. Is there a way, I mean, you just touched upon it, but is there a way to reverse those effects and even reverse the impact on your cognitive function?
Yeah, a lot of people have done that. Obviously, the earlier you catch somebody, if they're actually having some cognitive decline, the better it is. The longer they've had it and the further in cognitive decline, the harder that kind of stuff is. And oftentimes it's not just one thing like diabetes, but certainly diabetes is a big contributor for some people.
Yeah.
But yeah, again, so if somebody actually had cognitive decline, we would want to get them to the point where not only were they on a low carb, low sugar diet, but we would want to make sure they get into ketosis,
Mm.
meaning they produce ketone bodies from their fat, because the brain works much more efficiently on that
Yeah.
ketones than it does on sugar. Sugar, you need insulin and if you're insulin resistant, you can't work well on that. But ketones, you don't need any insulin. The cell knows how to just take that in and burn it for fuel. So even people who have other neurological disorders, people with uncontrolled seizure disorders, for example, the diet, it's been shown that a ketotic type diet helps those people because the brain cells work better. They have more energy. They work better on a ketotic type diet than they do on a high carb, high sugar diet.
And what is a keto diet for anyone who may not know exactly what that consists of?
So that's a low sugar, low carb diet to the point where you can actually, some people you can detect the ketones in the urine, but sometimes you actually have to prick people's fingers and check to see if there's ketones in the blood. But it's low enough so that your body is saying, hey, I don't have any carbs that I can burn. I'm going to start burning fat. And as it burns that fat, it produces these ketone bodies that are, as I said, a much more efficient fuel for the
Right.
brain, for the heart, even for our muscles many times.
So interesting. I mean, I've heard, keto is so trendy, I feel like right now, but really it does have so many benefits as well.
Yeah, yeah. It certainly has a lot of medical benefits for people who are, again, certainly for people who have insulin resistance, have prediabetes, have diabetes, have cognitive decline. Yeah, keto diet is indicated for those people. Other, like anything, but for other people, it's not the best thing. If people are thin, it's hard for them. They might not have enough body fat to create ketones and keep their weight, so they might start losing weight. So it's not for everybody.
Yeah. Yeah.
But I would say the vast majority of Americans can safely get into a ketotic type state without any issues. If you're diabetic and on medications, though, you have to do it under a doctor's supervision because your blood sugars could start going low pretty quickly sometimes. And so you have to have somebody who's willing to work with you on that to adjust your medications and that kind of thing. Make sure you don't have any hypoglycemic episodes.
Right. So as with many topics we discuss here, really nutrition and diet is fundamental really to prevention and then to reversal if it comes to that. So you'll notice a trend if you've been watching over the past few weeks, any of the videos that we have had regarding any topic that we talk about. So anything else you wanted to mention? I'm just going to go check on Facebook to see if we have any questions.
Sure. Since you mentioned that, especially for people who have insulin resistance, prediabetes, or diabetes, activity is very important. Things that move the large muscle groups, because those muscles can then take up sugar out of the bloodstream without actually needing insulin. So you kind of get around the insulin resistance when you're exercising, and that helps improve insulin sensitivity. So activity in people who have any type of insulin resistance, whether it's just insulin resistance, whether it's prediabetes or diabetes, is extremely important. That 150 minutes a week of moderate intensity activity, up to 300 minutes. The more that you can tolerate in that range, the better. The quicker you can get things under better control.
Okay, great. And that's, yeah, such an important part of it too. The activity, food, diet, rest, supplements if you need them. It's
Yeah,
all the
yeah,
common denominators.
yeah, and sleep. And sometimes the reason people get into insulin resistance is because they have sleep apnea, and then your body is constantly, when you have sleep apnea, you're putting out a lot of cortisol because that's very stressful for the body at night. And that has to be matched. When cortisol goes up, insulin goes up, and that leads to insulin resistance. So if you haven't been checked for sleep apnea and have insulin resistance or prediabetes or diabetes, it's probably a good idea to talk to somebody about that and get that checked also.
Great advice. We don't have any questions on Facebook, but if you have any, please feel free. Yes, Betsy, 150 minutes a week is very doable. I agree. And I just wanted to let everyone know too, next week we're going to be talking about stress and the brain. It is Stress Awareness Month. So we'll be having a couple different events throughout the month related to stress. Right now we have on our calendar April 21st at noon, we'll be talking to our acupuncturist, Joe Bonacci, to talk about muscle tension caused by stress and how acupuncture and trigger needling can help with that. And then the week after, I'm going to be talking with Jenna again about how extra stress can really help prevent us from achieving a healthy weight. So how stress and nutrition really impact each other. So we hope you'll join us for that. We'll have it on our Facebook page if you want to check out more information or sign up to join us. And otherwise, I'll be here with Dr. Vinny next Thursday to talk about stress in our brain. And feel free, of course, to contact our office with any other questions at 609-512-1468. Thank you so much, Dr. Vinny. I'll see you next week.
I'll see you next week. And just want to mention also, we do free discovery calls for people, if you call the office at that number. So
yeah, absolutely. Please, if you have any questions about this or other health related topics, if you call and want to schedule a discovery session just to ask some questions and see if it would be beneficial for you to come in and meet with someone. So please do.
Okay.
All right.
Great.
Thanks, Dr. Vinny.
Thanks, Krista.
Have a great night.
You too.
Everyone.